So good evening, everyone, and welcome to our Medicaid Direct session with Partners Health Management. We're going to wait just a moment, let everyone get logged in. I see our numbers ticking up, so I'll wait just another minute. All right, so looks like our numbers have leveled off. So welcome. My name is Ann Glove, and I am part of the member engagement team here at Partners Health Management. And we are so glad that you joined us this evening to learn a little bit more about Medicaid Direct, as it is soon going to be launching. So joining me today as my co-facilitator is Latasha Scott. She is a health educator, also with member engagement. And she is managing all of our behind the scenes Zoom. She is the Zoom guru for this evening. She will be entering information into the chat for you as we move through our presentation this evening. And we also have several subject matter experts with us this evening to answer your questions tonight. We want to make sure that you get all the information that you came for. So when we get to the question answers part of our session tonight, they will introduce themselves as they answer the questions. So before I get started on all of our content this evening, I just want to share a little bit of housekeeping information with you. First and foremost, our session is being recorded. So I want to be sure that you don't share any sensitive personal information during our call if you raise your hand to answer a question. Partner staff is available for an individual call to talk about specific issues for yourself or a family member that you want to discuss. We can schedule a one-on-one session for you. Also wanted to let you know that we are offering this session in closed captioning. So if you don't need this feature, at the bottom of your screen, you can simply hover over the closed caption and turn that off if you don't need the transcript. The other thing is that our chat feature is disabled for you this evening. However, our Q&A is active. So as we go through our information, I encourage you to put questions into the Q&A. You'll find that at the bottom of the screen right next to the chat. And then the recording will be available after the session. Give us a little while, about a week before we can get it posted on the website. So it'll be posted for viewing, and we will be sending an email to all of our attendees with the slide deck after the session. That'll go out within the next couple of days as well. And if you do want to raise your hand when we get to the Q&A time, you're just going to go to the bottom of the screen and you'll see a raise your hand option. And then Latasha is going to unmute you and enable you to speak into the mic and ask your question. All right, so just one more thing before we get started on our content. What I want you to remember is our primary audience for tonight is you, our members, your family, and stakeholders. And I know we also have many providers also attending the session, and we welcome you as well. However, we want to make sure our members and family members have the opportunity to ask their questions and get them answered. Any questions that you enter for providers, what we'd like to do is go ahead and capture those questions and forward them to our provider network team, who will respond to your questions in the following days. All right, so now let's go ahead and get started. Latasha is going to share our slide deck for us so we can share more information. All right, so here we go, Medicaid Direct. So you can go ahead and go to the next screen. All right, so before I go into Medicaid Direct, just in case there is anyone here who is not as familiar with Partners, I'd like to share just a little bit of information about Partners before we delve into Medicaid Direct. So Partners is an insurance plan for Medicaid and state funded, and we manage a network of providers to ensure access to care for people under a contract with the state of North Carolina Department of Health and Human Services. So that network of providers they have a lot of experience helping people who may need supports for behavioral health. And behavioral health, I know you've probably heard those words many times. So as I mentioned the words behavioral health this evening, I want you to think of all of the individuals that have a mental health, developmental disability, traumatic brain injury, substance use disorder, all of those individuals who need support and treatment for those diagnoses. So that is behavioral health. Partners also manages a care center to help people, a call center to help people access information and services and supports, including a crisis line. So this system of care we manage is shaped by the choices of our members and their families and is designed to meet the unique needs of each of the communities that we serve. So we will begin managing one of North Carolina Medicaid's tailored plans in October. October 1 is when that goes live. And at that time, we'll begin managing physical health along with behavioral health as part of the tailored plan for October 1st. But tonight, we're here to talk about Medicaid Direct, which you know is going to launch on April 1st. And Partners and all of the other LME MCOs across the state will be managing behavioral health services for Medicaid Direct. Next slide. So Partners currently serves 14 counties across North Carolina. There is, as I mentioned before, there is a managed care organization, LME, MCO, for all of the counties across the state. So the counties you see here on the screen are the 14 counties that we cover. Next slide, please. All right, so you have heard a lot about managed care, and you've also probably heard a lot about Medicaid transformation. So let's start out by talking about managed care. So what is managed care? It is simply an approach that North Carolina Medicaid has adopted to deliver healthcare services through a health plans network of doctors and other medical and behavioral health professionals. So it incorporates whole person-centered care. And what that means is it's bringing the mind and the body together. So it's covering both behavioral health and physical health care. And it also includes other services such as pharmacy and care management. So now let's talk a minute about Medicaid transformation. So you may know that the beginning of Medicaid transportation, let's try that one more time. The beginning of Medicaid transformation began in July of 2021. And that was with the standard plan. And actually, most people with Medicaid are served by the standard plan. And the standard plans are managed by 5 different commercial health plans. You may have heard those names. You may have seen them on Medicaid ID cards. So those plans are WellCare, Healthy Blue, AmeriHealth Caritas, Carolina Complete Health, and United Healthcare of North Carolina. And so, as you know, Medicaid Direct begins serving some additional populations on April 1, which I'm going to share with you in a little bit. And the tailored plan, the purpose of the tailored plan is to manage individuals who have more complex behavioral health and physical needs. And again, that starts in October. So next slide, please. All right, so these are our objectives for this evening. We're going to take a look at what is Medicaid Direct, who is served by Medicaid Direct, what are the services. We're going to touch on your rights and responsibilities, and where you can find more information. You may have already, if you are part of Medicaid Direct, you may already have received a welcome letter. And that would have included a handbook and information about care management services. So Medicaid Direct, what is Medicaid Direct? It really is how we are operating now. All 6 of North Carolina's LME MCOs coordinate services for behavioral health. There's those words again. And remember, it's mental health, substance use disorder, intellectual and developmental disabilities, or traumatic brain injury. So North Carolina Medicaid Direct is traditional fee for service. So what does that mean? Traditional fees for service means when you go to the doctor, you go to the hospital or another medical provider, that medical provider sends a bill to North Carolina Medicaid for the services you receive that day. On the behavioral health side of things, those claims and bills come to Partners Health Management. So fee for service is when you go to the doctor, the hospital, and they bill Medicaid Direct. So it's just simply how they get paid for their services. So Medicaid Direct beneficiaries, not a whole lot is going to change for you. You're going to continue to go to your doctor when you're sick or hurt or need support managing a health condition like diabetes or maybe a heart condition. And their doctor will continue to send a bill to North Carolina Medicaid. And as part of North Carolina Medicaid Direct, you may be eligible for care management. So let's talk about who is served by North Carolina Medicaid Direct. So as we look at this slide here, I'm actually going to start talking about the list on the right. So served by Medicaid Direct is long-term nursing care, medically needy, state-operated health facilities, for example, for veterans homes, those who are covered by both Medicare and Medicaid. Those are often referred to as individuals who are dually eligible. Our kiddos who are in foster care and adoption, some of them may be dually eligible as well. Individuals who take part in the health insurance premium program, sometimes referred to the North Carolina HIP program. And then those individuals in CAP-C, Community Alternative Programming for Children, and CAP-DA, which the DA stands for Disabled Adults. So now I want to go over to the left side of your screen. The reason we have them split apart is because the left side of your screen shows new populations that will be served by Medicaid Direct and managed by Partners Health Management and the other LME MCOs across the state. So on the left, the first population you see is North Carolina Health Choice. Beginning April 1, North Carolina Health Choice members will move to Medicaid. We'll also have a new population of serving our very little ones, ages 0 to 3, birth to 3. And most often, this population is served by what's referenced to as the CDSA, the Child Development Services Agency. But sometimes there are services that are needed outside of that, and that's where Partners will come in and Medicaid Direct. And we'll also be serving legal immigrants or anyone that is exempt or excluded from North Carolina managed care. And we've already talked a little bit about managed care. So right at the bottom of the screen, there is a link there, which Latasha just dropped in the chat for you. So if you want more information about who is served by Medicaid Direct, you can find that information at that North Carolina Medicaid Plans.gov site. All right, so let's start talking a little bit about Medicaid Direct services. Now I'm going to start right in the center of the screen in that center column where it says prepaid inpatient health plan. So Partners, or an LME MCO, is a prepaid inpatient health plan. And again, we covered the North Carolina Medicaid plan for behavioral health services. And we also manage the 1915C Home and Community-Based Services waiver. And you may know that as the Innovations waiver for those individuals with intellectual and developmental disabilities. All right, so another part of Medicaid Direct, I mentioned fee for service. So let's talk a little bit about that. It's in that left column there. So fee for service will remain in place for physical health, pharmacy, etc. Again, as I mentioned, beneficiaries will continue to go, or beneficiaries are members, same thing, will continue to go to their doctor, pharmacy when they're sick or hurt, need medication. So no change there. Their doctor will continue to send a bill to North Carolina Medicaid to get paid. We'll also be managing Cap C and Cap DA. The Cap C is for children, Cap DA is for adults. Those waivers will be under fee for service. There's also state plan long-term services and supports. Sometimes you know that as LTSS. And then non-emergency medical transportation. And that will continue to where our members will call their local DSS to schedule rides using that transportation. All right, so now if you take a look over to the right side of your screen, that third column there, care management. So let's talk a little bit about that. So under Medicaid Direct, there is care management, and it is administered by CCNC, Community Care of North Carolina. And that provides care management for those in Medicaid Direct for physical health. If you're eligible for the tailored plan, you may already be receiving tailored care management, and that will continue. And those who are eligible for the tailored plan, when we go live in October, they'll be eligible for tailored care management. Another care management entity is CMARC. CMARC stands for Care Management for At-Risk Children, and that provides care management for children that are at high risk. And then there is care management for high-risk pregnancy, providing care management for high-risk pregnancy through our local health departments. And then I already mentioned tailored care management. All right, so let's go on to our next slide. Now we're going to continue talking about North Carolina Medicaid Direct services. There's a lot of information on this slide, a lot of words. So what you see here, these are the services that are offered by Medicaid. So those are in the standard plan, can access all of these services, and those are in Medicaid Direct, can access all of these services. And so they include things like detoxification and stabilization services, diagnostic assessments, early periodic screening, diagnosis and treatment, also referred to as EPSDT. This is for children under age 21. It includes mobile crisis management, outpatient mental health services, peer support, professional treatment services in a facility-based crisis program, and research-based mental health treatment for autism. The best example I can give you for that last one is ABA therapy, applied behavioral analysis. That's something that many have heard of for autism. That same link that you saw on the previous screen is here as well, because you will be able to see a full list of services there. Well, let's go on to the next slide. And here, what I'm going to share with you is what is enhanced services that are offered under Medicaid Direct, but they're not accessible under managed care, which is that standard plan. So at this point in time, you have to be in Medicaid Direct to access these services. And they're listed on the screen are things like a residential treatment facility for children and adolescents, adolescent day treatment services, intensive in-home, multi-systemic therapy services, also known as MST, psychiatric residential treatment facilities, PRTF, assertive community treatment, which is the ACT service. And then down on the right column, you see intermediate care facilities for individuals with intellectual and developmental disabilities. And you'll often hear this referenced as ICF, IID. And substance use services, SACOT and SAOP. One is outpatient, one is inpatient. and a little bit more intensive. And then our innovations waiver services are managed under North Carolina Medicaid Direct. No difference there than it is now. And then last listed is the 1915B3 services. And I feel like you all may have heard that these services are transitioning to the 1915I. So again, you're going to see that same link at the bottom of the screen that you can go to see more information about those services. So one thing I wanted to share with you is about transitioning between plans. I mentioned that if you're in the standard plan, individuals can't access those enhanced services. So there is an opportunity to transition between plans, and those in Medicaid Direct may transition in between plans. And so the primary reasons to transition is a change in the needed services. That's most common. Could be a change in a county of residence. Maybe you moved. And so what that means is that you need to move on to another LME MCO. For example, if you moved out of Partners area and you moved into Mecklenburg County, you would be part of the Alliance area. Another reason to change might be that your Medicaid status changed. So if any of these things occur, I wanted to share a little bit with you about what do you do? What's the process? So Partners Health Management has a transition of care team that will help make the transition process go as smooth as possible. So there is a request to move form that anyone can submit. You can see a link right there on the screen, and I'm sure Latasha has already dropped it right into the chat for you. So again, anyone can fill out that form. However, if you reach out to your provider or your current health plan and have them assist and submit that form for you, this is the quickest way to start the process. The link to the request to move form is already been placed in the chat. And if you have any questions about transitioning, you can reach out to Partners and talk to our transition team, or you can reach out to our enrollment broker, the North Carolina enrollment broker. And the phone number is there on the screen, that 833-870-5500 number, or TTY if you have need some help with hearing, it is 833-870-5588. Also wanted to let you know that there is a separate form for a provider, and Latasha would be dropping that link into the chat as well for providers. All right, we can go ahead and jump into the next slide. Got a little frog in my throat, needed to get some water. All right, so now we're going to switch gears a little bit and talk about rights and responsibilities. So if you're covered by Medicaid Direct, you have certain rights and responsibilities, and it's really so important that you're aware of the rights and responsibilities and that you know where to find this information. So let's take a look at this. What you see here on the screen is just kind of a short clip of some of the rights. It's a nice long list, and we're going to share with you where you can find the full information. But as we look at this one, you can see that members have the right to receive services and be free to exercise their rights while they receive those services. They have the right to have rights and responsibilities presented to them in a way that they can understand. A right to be treated with respect and the recognition of dignity, and the right to privacy by partner staff, network providers, and others who are part of your health team. The right to connect to providers in our network to get the services you need. And you have the right to file a grievance or an appeal if things are not going well. So Partners supports that all people are free to exercise their rights. Knowing and understanding your rights helps you exercise your rights. And Partners also expects all providers to let you know your rights and to help you understand them. The rights and responsibilities outline exactly what you can expect from your healthcare experience and how you can improve that experience. So in addition to what you see on the screen, I wanted to share with you that people who reside in 24-hour facilities have additional rights, as well as minors who have the right to treatment to certain conditions without the consent of their parent and guardian. And also, individuals with intellectual and developmental disabilities have additional rights per the Mental Health, Developmental Disabilities, and Social Security Act of 1985, which can be found on the internet. And Latasha will drop that link into the site for you as well. So as a member of Medicaid Direct, you'll receive a copy of your rights and responsibilities. You may have already gotten that welcome packet. I mentioned it earlier. And in that welcome packet was a member handbook. And so in that handbook would have a list of rights and responsibilities. So Latasha, let me go ahead and go over the next couple slides. When we get to the question time, I'll go ahead and share the website so we don't have to flip back and forth. All right, so going forward with rights. So what do you do if you feel like your rights have been violated? You call. So we want to hear from you here at Partners if you feel like your rights have been violated. You can call Member and Recipient Services. That's their number on the screen there, the 888-235-4673, or you can call Member Engagement. Member Engagement can help you with that and get you connected where you need to be and help you navigate. That number is 704-884-2729. However, if you feel like you want to talk to someone outside of Partners, that's okay too. You can call the North Carolina Medicaid Ombudsman, and that number is on the screen as well. It is 877-201-3750. So any one of those places you can call to get support if you feel that your rights have been violated. Great. So along with rights are responsibilities as well. And so here you see a short list. And again, this is just a snippet of responsibilities. So what are your responsibilities as a Medicaid Direct member? You're responsible to treat healthcare staff with respect, to give partners feedback on our policies, to tell partners if you have any problems or concerns with your healthcare. Just mention that you could call if you feel like your rights have been violated, but if you have any problems and concerns, please let us know. And you're responsible to keep your appointments. And if you need to cancel, you need to call your provider as soon as possible. All right, so different places that you can find your rights and responsibilities. The welcome letter that you received would have mentioned the rights and responsibilities and pointed you towards your handbook. The Partners Medicaid Direct Handbook. You can find it on Partners website, which I'm going to show you in just a moment. You can also go to Member Connect. Member Connect is our member portal where you can create a login to see not only your rights and responsibilities, but other information as well. If you're unable to utilize any of those things, you can give Partners a call and ask for a copy. And then you can also attend Partners education and training events like you're attending this evening. All right, let me just share some contact information before I share my screen to show you the Medicaid Direct site. So I mentioned the North Carolina Ombudsman before. So if you're not familiar with the word ombudsman, an ombudsman is a person or a role that speaks up for others who may not have a strong voice. So the ombudsman is there to help you. Their program helps you understand the Medicaid program, and they can offer help if people with Medicaid have trouble getting access to healthcare. They can connect you to resources like legal aid, social services, housing resources, food assistance, and other programs. Then the next one down that you see is the North Carolina Enrollment Broker. And so the North Carolina Enrollment Broker is a third-party agency that provides information on enrollment, and they provide counseling to beneficiaries and can help members choose a health plan. Below that, you see the North Carolina Medicaid Contact Center for Providers website and phone number. Local DSS, that link right there is going to give you a directory so that you can find the phone number or contact information for the local DSS for your county. And of course, last but not least is Partners Health Management. There's that 888-235-4673 number to our member and recipient services, and member engagement at 704-884-2729. All right, so before we go into our question time, I just want to quickly share my screen and show you the Medicaid Direct site. So let's see if I can make that happen very smoothly. All right, Latasha, can you give me a thumbs up if you can see it? I got a thumbs up. Okay. All right. So this is Partners North Carolina Medicaid Direct website. This will be going live later on this week to get ready for our April 1 launch. And so what I wanted to show you was up here at the top, you see different links you can click on. So if you wanted to go to the and look for your manual, your member manual, you're going to go to the handbook, excuse me. You're going to go to the resource library and you can see member handbook. You're going to click there and you'll be able to see an online copy of the member handbook. The other thing that you can do on the website, on any of the partners' website, is access Member Connect. So right here in the upper right corner says Member Connect. You're going to click here. It's going to enable you to create a login for your Medicaid or for your family members' Medicaid. And there you're going to be able to see your member handbook, other documents that you might need access to, other resources. You'll be able to search for providers, take assessments, just a myriad of things. So it is a portal for you to go into and get information. All right, so I'm going to go ahead and stop sharing. And now I'm going to take a look at the Q&A. It looks like we have a few questions here. All right, the first one is, will you be sending the slide presentation to attendees? Yes, so we will be sending out an email which will include the slides. It should be, I would expect it within a week for that to go out, sooner, I hope. And we got a nice comment from Amy Brundle. What a great looking group of panelists. Thank you, Amy. All right, so question. What Medicaid entity is currently reimbursing for ages 0 to 3?
I can answer that one. So most of the birth to 3 age group are being managed by the standard plans. So if they meet, the child meets tailored plan eligibility criteria, then they will be transitioning to the LME MCOs for Medicaid Direct on 4/1. So if they meet that criteria, because they'll be potential, they'll be with Medicaid Direct based on their eligibility of needing potentially more enhanced services.
Thank you, Allison. Next question. Is Partners and all MCOs going to be managing CAP C and CAP DA?
Hey, this is Tammy with IDD Care Management. I can take that one. We are not going to be managing the CAP C or CAP DA waiver programs, but individuals that are participating in those waiver programs can access some services through Partners, such as someone in CAP DA who might need outpatient therapy, or I'm trying to think of another example. Charity, can you think of another example?
Someone in CAP DA needing ABA. Did you say ABA?
No, I used outpatient therapy as an example, but that's, ABA therapy is another one.
Great. Thank you, Tammy and Charity. All right. Let's see. Our next question is, will kids in DSS custody be enrolled in Medicaid Direct?
So I can take that one as well. So the answer is not necessarily. So some children in DSS custody are not eligible for, okay, maybe somebody else is going to have to help with this. So kids in DSS custody, foster children, former foster youth up to age, I think 26 or 27, and children receiving adoption assistance currently are excluded from managed care in North Carolina, which means I guess technically they're all in Medicaid Direct for now. But only some of those children are eligible for tailored care management, which Ann mentioned earlier. The children, the foster children that would be eligible for tailored care management would be those who, if they were not excluded from managed care, they would be tailored plan members in October. So the children who have significant behavioral health needs, or an intellectual and developmental disability, a traumatic brain injury, those children will actually be eligible for tailored care management through Medicaid Direct, whereas the others won't be getting tailored care management, but they would be eligible to get outpatient therapy, ABA, respite, other services that they may need.
Thanks, Tammy. All right, so next question. If a plan member does not present their current insurance card at a visit and then comes in months later, do we have to file those previous visits to insurance? And then there's a second part of the question. If they wait till the point when the claim is then timely, do we have to file that claim, or can we still bill the patient?
So I can take that call, Ann.
Thank you, Rhonda.
That question. So first of all, I would encourage you to check the member's eligibility yourself. Don't depend on the member to provide that information, because they don't always provide it. And also some members aren't always aware of the type of coverage they have. So you have the capability to do that with Alpha Plus. And then you should also have the capability to check the member's eligibility through NC Tracks. You should not be balance billing members that have Medicaid coverage. So I'm reading parts of your question to make sure that I answer everything. As long as you're verifying the information, then you shouldn't get outside the timely filing guidelines. You have to bill other insurance prior to billing Partners for Medicaid, the Medicaid coverage. If you are uncertain about the coverage, when you're viewing that inside Alpha Plus or NC Tracks, you can certainly call Partners. You can call the eligibility enrollment department to verify coverage. And you can also, if if you reach out to claims department, we would also help provide that information for you. So I guess the best thing to do is be proactive in verifying the information yourself.
Thank you, Rhonda. All right. This question, we might need a little more clarification. If we would like to be included on the new service delivery, the one where we can provide the tailored care management services and enhanced, I think the question is not finished.
And I can, this is Beth. So if you are a provider, I believe that we've got a question that you're reading that you would like to, if you're a provider and you want to add new services to your contract, there is a provider change form. Also, we have a provider support line that we're able to offer assistance. And if you're currently in-network contracted provider delivering services, then reach out to your provider account specialist to add additional services. If you're asking about delivering tailored care management services, that is a certification process that providers work through the state to become certified, and those occur during phases where the state opens those up. And so that one's a little bit more complicated, but if you want to reach out, you can reach out to me, Beth Lackey, or you can reach out to your assigned provider network account specialist to get you some more information to clarify that question. We're happy to answer that.
Thank you, Beth. All right, next question. I feel that you said, but for clarity, are providers to serve Medicaid Direct consumers with the tailored plan care management as well as LME MCOs?
I'm not sure if I quite understand the question. Providers do serve members that are receiving tailored care management, if that's the question. Medicaid Direct members who receive tailored care management would be getting a variety of services through the provider network, whether they're behavioral health services or IDD services, TBI services, et cetera. If perhaps the person who wrote the question could clarify.
Is it the question about Medicaid Direct? Do providers as well as the plan provide tailored care management? So external agencies, is that, do you think that's the question?
Yeah, I think so. And if there's additional questions, then we can answer that. But for the sake of clarity, we have Medicaid Direct members that are served receiving tailored care management, and we have tailored plan members when we operate and go live in October that will also receive tailored care management. So providers, and not duplicative, the plan partners provides tailored care management. So we have kind of three realms of this. So we have providers serving Medicaid Direct and tailored plan members in tailored care management. And then we as a plan or as an LME MCO also provide tailored care management. Some members, and Tammy will correct me if I'm wrong, some members choose the plan to continue their care management. Other members serve or choose the provider. So there is a choice period for that. But I think to answer for clarity's sake, Medicaid Direct members are being served by providers and by us, but that's not duplicative.
Right. And the only other nuance to that question that you may have been trying to get at is if an individual is not eligible for tailored care management, can they still get services? And yes, they can. So we do have members that are not eligible for tailored care management, such as those enrolled in CAP C or CAP DA, or getting their primary care management through CCNC. They can't get tailored care management, but they're still eligible to receive their behavioral health and IDD services through partners.
Thank you, Beth and Tammy. Appreciate that. All right, another question. We are an outpatient mental health provider that is curious about our Medicaid clients using insurance like Healthy Blue, etc. during this transition time. What will happen to those clients who are receiving one-to-one? What will happen to those clients who are receiving one-to-one opt with us?
Opt may be outpatient treatment.
Okay, outpatient. What will happen to those clients who are receiving one-to-one outpatient treatment with us?
This is Rhonda. I'm not sure I fully understand the question to be able to answer it, but certainly if they could send me an email, I'll be with a little bit more information. I'll be glad to help them. And I can put, or somebody can put my email address in the chat. I can do that. I want to make sure I fully understand what they're asking. I'm not sure that I do.
But if somebody has Healthy Blue, that's one of the standard plans, and they provide the North Carolina Medicaid state plan services, which includes outpatient. So that you would bill through the standard plan. From what I can gather from the question.
And this is Angela with Member Engagement. I'm the Transition of Care coordinator. So I think I may know that they may be asking about if it's outpatient plus. If it is outpatient plus, that is an enhanced service. So that member would need to be transitioned to partners in order to receive the enhanced service of outpatient plus. That may be what they were asking. So if that's the answer to that.
Thank you. And if you all need to clarify questions, please feel free to raise your hand and we will, Latasha can take you off mute so you can share your question. All right. Let's see. Will the LME open up the network for new providers?
I can take this one. I can take this one and I'm talking on mute just to myself. So Partners has always taken the stance that we want to make sure that our members have optimum choice of providers. We have been diligently working to contract for services that we want to make sure that members have access to in our network. So if there is a service that you don't provide or you're not currently contracted with us, we have a request for consideration form. That is a fancy way of saying we want to collect some information to do some validation so that we can then outreach to you to see the services that you provide. We do, while we have the opportunity to have a closed behavioral health network, Partners wants to make sure we maximize all of our services across all of our 14 counties and wherever members may live. So if you have questions about that, please reach out so we can connect with you.
Thank you, Beth. All right. Will all children under the age of 3 who receive RB/BHT services transition to Medicaid Direct under the management of the LME-MCO?
Hi, this is Charity Bridges with Utilization Management. RB/BHT is one of the services that can be provided under both the standard plan and the tailored plan, and in Medicaid Direct. So the answer to your question is no, all members would not transition.
Thanks, Charity.
But some will. And we do have someone with their hand raised.
Oh, okay. I cannot see that. So let's go ahead.
It's Caitlin Gallagher.
Okay. Latasha, do you want to take her off mute? Now I can see Caitlin's little Hollywood square.
One trick that I had to learn the hard way is if you're on your phone, you may have to hit *6 to unmute yourself, even though you might be pushing a button somewhere. I've done that the wrong way.
Caitlin, are you able to unmute yourself? Latasha, are you able to unmute her?
I'm not. I've sent the request for her to unmute herself, but she
I think
hasn't.
she entered in the Q&A that she raised her hand by mistake.
Okay.
Okay. All right. Is there anybody else that have their hands raised that I missed?
There is Annie.
All right, Annie, can you unmute yourself?
I'm sorry, I hit my hand by accident.
That's okay.
Easy
Go
to
ahead.
do.
Go ahead, please. All right, so she didn't raise her hand either then. Okay. All right, so we have a few more questions. All right. Well, here's one. Why so many different plans?
So I can start that, but so if you're referring to why are there standard plans and tailored plans and Medicaid Direct, I think it just is to meet the best service needs for the members. So it's not unusual for states to have specialty plans for Medicaid if they have more complex needs. And that's what the tailored plan is designed to do. But overall, the standard and tailored plans are designed to meet the whole health integrated needs, to integrate the system, because we understand that physical health and behavioral health and other conditions are interrelated. So then as far as Medicaid Direct, there are some populations such as community alternatives programs and innovations waiver that have very different service delivery, and they have care management that's embedded within the program. So the state has tried to provide tailored care management for those managed care populations and not to miss some of those needs for members who are in Medicaid Direct who may not be getting care management in their program. So it is very complex. There are lots of different types of Medicaid plans, but basically the standard plans have that standard service array, and it includes physical health. And then the tailored plans in October will do the same. I saw that there was a question about tailored plan. So some of our members will be, we will manage not only their behavioral health and intellectual disability and traumatic brain injury services, as we have for many years. But we will also manage the provider network for their physical health and offer some special services like a nurse advice line, pharmacy services will run through us, and we'll pay for those services and offer resources. Long answer.
All right, I know we're coming up on time. We have a few more minutes. We have a couple more questions. What is RBBHT?
I'm going to get us started and then I'm going to let Michelle speak a little bit to it. RBBHT is research-based behavioral health treatment. It is a service definition that we utilize for the autism spectrum disorder population or children with autism spectrum disorder. It is a service in which evidence-based practices can be provided under this service definition. It does not have to be ABA. It can be other service modalities, whatever best fits for that member. Michelle, would you like to add to that at all?
You did a great job, Charity. Absolutely. If you're interested in the RBBHT, you can find it under Clinical Coverage Policy 8F. So that's 8F as in Frank.
All right, what is the best way to know if the consumers we serve are transitioning to Medicaid Direct?
I can start that. The best way to know is to look in North Carolina NC Tracks system if you're a provider. And also you will know if for members, they'll know that they're Medicaid Direct because their ID card, their insurance card will be a light colored gray and rectangular paper. And if they're under a standard plan or a future tailored plan, they'll have a smaller card that looks like more like an insurance, commercial insurance card.
Thank you, Allison. What about Medicaid Direct is being canceled?
I'm not sure I understand that question.
Yeah, we would need some clarification on that because Medicaid Direct is actually launching on the 1st, the Saturday. But it's also how our current system is called Medicaid Direct because the physical health is being managed by North Carolina Medicaid, by any Medicaid provider for physical health. And then you can get your behavioral health needs, intellectual and developmental disability, substance use, and traumatic brain injury through the LMEMCOs.
Okay, so Joe asked that question. So Joe, if you want to come off, if you want to raise your hand, we can unmute you to clarify if you wish. All right, here's an extension of, it says, I was the one who asked about the transition of RBBHT services for children under the age of 3. How will we know which children will transition to Medicaid Direct under the LMEMCOs on April 1st and who will not?
I think that goes back to Allison's answer about NC Tracks. And we also have a screening and referral team. Beth, do you have that number that you could provide?
Yeah, I can. Oh, I'm sorry. There's a couple of Beths. Sorry.
I'm
Good
sorry,
job.
Beth Monaco. I'm sorry.
Yes, I will put it in the chat.
Okay, and you can always call member or provider services at 1-888-8, I forgot an 8, 235-4673. And that's been our traditional partners line. We call it the Hope Line. And you can connect with provider services or member services and get some assistance.
All right, so Joe, who asked the previous question, added, we are being told our son is being moved to tailored from direct, and we're being told that direct is being canceled.
So it's just all very confusing.
Yes.
So you initially got a letter saying that your son was going to be in the tailored plan. Then you got a letter saying the tailored plan's being delayed and your son's being enrolled in Medicaid Direct. But if your son was eligible for tailored plan, that's still going to happen. It's just delayed until October. So basically it means that your son will continue to get the services that he needs through partners. It's just called something different until October, when the tailored plan launches, and partners would also be paying for his physical health services as of October. So for now, the behavioral health, like the mental health services, the IDD services, TBI would continue through partners. And then once the tailored plan does launch, the physical health services would be added. So it has been very confusing. People have gotten multiple letters, and many, many people have been confused by the letters.
Thank you, Tammy. And Joe, I would like to encourage you to, if you would like to have a further discussion about that, you are most welcome to call our member engagement team. So our member engagement team's role is to do just that, educate and help you help answer your questions specifically about your child. So that number is 704-884-2729. And I know we are at 7:02. I'm gonna pull one more question here. It says, can you clarify what the insurance card will look like for the standard plan? And I know Allison described that. And so the standard plan card is going to look like any commercial insurance card. It's rectangular but small, not like your paper Medicaid card. The Medicaid Direct ones are the paper Medicaid. They're longer, they're gray. So I hope that helps.
Yeah, and it'll also have the plan name on it. It'll be Healthy Blue, or well, it'll be Carolina Complete Health. It will be Healthy Blue, United, AmeriHealth, Caritas, one of the plans.
Right. Okay. All right. So great discussion, great questions. Thank you all for joining us tonight. And again, the recording will be available probably within a week, and we will get an email out to you all with the slides. And I encourage and invite you to call our member and recipient services line or member engagement if you have additional questions. That's what we're here for. We are more than happy to help you. So thank you so much and enjoy the rest of your evening. Bye, everybody.